Hello, everybody. Today we're going to have a to-do video for the regulatory plan. What we're trying to do is we're trying to assist understanding of the Notion templates by creating videos for each of the segments that need to be done. So what we have on the screen here, the phase one checklist template. When we get to the point in phase one where we need to do a regulatory plan, it'd be the regulatory lead who's going to do the plan or lead the plan. We might need a clinical person, potentially software person involved too. But so this is kind of an origin document for the regulatory perspective and the strategy that's going to be employed to guide the regulatory portion of the project. So let's go to the plan. Okay, so the regulatory plan has a few basic areas in the beginning, the purpose, which is regulatory strategy in this case, the scope. This usually will be, almost always will be for a particular device, the definitions, references, some background information. This is where the meat really starts. So the client name comes from the product variables and will feed in when it's exported. The product status, this tells the person who's doing the plan whether this is a brand new device. A client has come to us with an idea and they need to know what the regulatory pathway is going to be. Other options are a minor change to an existing device, maybe addition of a few more features that don't change the primary functionality of the device, maybe some type of a new measurement or something from a software perspective that doesn't change the intended use or indications, or a large change, which let's say we have an existing product that does calcium scoring on the coronary arteries. Let's say we're going to do something with the vasculature in the head or neuroanatomy. That would probably change a significant way the program worked, and the indications adding neuro on top of cardiac would probably change the regulatory strategy. So we would select change to existing major. Plan scope, at the moment, we're mostly concerned with the United States, but we wanted to leave open some growth for doing regulatory plan strategies for other areas, other countries, other regions. So under the product information, product trade name, this is good to know early. It feeds a lot of the documents, but nice thing about the variables, if it changes, we can change it at any time, update the documents. The version that is intended to be commercialized, let's say it's version 1.0, and that's another variable that comes in. An extremely important part, of course, is the device description. This is the way that the person doing the plan can understand what the product is, what it does, who it does it to, indications such as population, anatomical area, disease treated. We need to know as much as possible about what this software, in our case, looks like. Will there be different models of the software or just one? Will it be modular, where you can license different modules that do different things? Are there accessories to it? Or is the software device an accessory to something else? Let's say it does calculations that you can use as a plug-in or something to an existing device. I don't know, radiation treatment planning or something like that. Diagrams are very important. From a software perspective, we're usually talking about an upper level, top level architectural diagram that lays out the systems, the interaction, HL7, connections to other devices, the modules, the main modules and their functions that the software consists of. So these are something that we would like to have early. They can be updated, but primarily we need them to understand what's going on. Key marketing claims. This is important because oftentimes we see that we come up with an intended use based on something, and let's say the client then has this idea of what they're going to put on their website and what claims they're going to make. And it's not uncommon for these claims to be counter and not aligned with the intended use, which definitely throws a wrench into the regulatory scheme, because FDA sees marketing collateral materials as labeling, and you can construe an intended use from the marketing claims. Intended use, basically what the product is and what it does. And this differs a little bit from indications for use. For indications is really where something's intended to manipulate and enhance images. An indication would be that it was meant for, let's say, lung cancer in adults. So lung cancer is a specific treatable condition, and adults is a population. That's kind of more what we're talking about with indications. Contraindications is something that there would be some risk involved if the product was used in a way that it was just not designed to. And you'll see this a lot with imaging products where they're not specifically designed to do mammography and be used for breast cancer diagnosis. Well, this was kind of a funny example. That a contraindication is don't use YouTube video as a replacement for a qualified surgeon. You can find a lot on YouTube, but you don't want to do your own appendectomy there. Proposed use environment is where it's intended to be used. Again, from a software perspective, are we talking about a doctor's reading room, or radiologist, or are we talking something, let's say it's software that assists a surgical robot, which is going to be proposed to be used in a surgical suite. We concern ourselves a bit in the early stages with the regulatory plan of what the labeling is going to look like. This would be the marketing materials, it would be the primary label. With the UDI, it would be the user manual. And back to the labeling area. So marketing claims, we would ask the client, what's the absolute minimum claims that you would need to, have a commercially viable product? And we would list them here. And what evidence do we have that supports that? And then what optimal claims we would like to have? Because when you're doing the regulatory strategy, you need to balance the claims, and sometimes they become grandiose, and just have to kind of have a heart to heart with the client and say, well, this is going to take it down a different pathway. This is a revolutionary device which cures all known ailments or something. That's not really feasible. So we try to figure out early on what fence we can put around the product to get them to market as quickly as possible. Similar competitive products, we usually get a lot of this information from the client, because the client understands the space the best. They know why they're going to create this product in the first place. So oftentimes there's a wealth of information that they say, oh yeah, we're going to go up against whoever, their product does this and ours does the same thing, but it does better. So we gain information here. From a regulatory perspective, once we have that information above the device description and the claims and all that, we can start to figure out the regulatory identity, I guess you could say. So classification name is the regulatory classification, a picture archiving and communication system, or just the name that the regulation would have. There's a number associated with it. FDA has categorized devices into quite a few different sort of subsections, and there's a regulation number. Usually it's a 3-digit number and then a 4-digit number to follow, like 892-2050 or something like that. The description is provided in these regulatory databases that FDA has, and also we have a tool. NLS has created an FDA viewer that looks at the different databases in a kind of nice, clear way. classification. Was it class 1, class 2, class 3? The product code would be aligned to the regulatory classification, and sometimes for a particular regulatory number, there's multiple codes. So there's variations of the of that type of device that they've codified differently. And review panel in the SAMD world, in our space, oftentimes we're talking about radiology, could be neurology, could be dermatology, but radiology is one of the review panels too. Potential predicate devices. This is similar to, but not exactly the same as the products above. Sometimes there's products on the market that maybe should be medical devices, listed as medical devices with the FDA that aren't. So that is definitely a starting point, is to have the similar devices, take a look at those. But once we know what a product does and what regulatory class it falls in and the product code, we can search FDA's database or use analytics tool to go find potential predicates that have an intended use and indications that are as similar as possible to our device. If something is novel or new to the world and there's nothing out there, that's important to know, because at that point, based upon the risk classification, perhaps it's a class 1, which means that there's typically no pre-market application needed, but more often than not, something that is a mid-risk but doesn't have a predicate would be subject to a de novo application, which is, it's similar to a 510K, but there's nothing that you're comparing it to. It stands on its own in terms of its risk. It's the proof that you have for its safety and effectiveness, and it's a bit more difficult. But once the de novo is granted, then that device that has a DEN number is then able to be used as a predicate for other devices that come to follow that one. Reference device, similar to a predicate, but not the same. If you have something technologically that differs from the predicate, where the predicate has the same intended use and primarily the same technology, but let's say there's something that your device does that predicate doesn't, you can use a secondary predicate, but let's say that it's a coding for an implant or something like that, and the coding was used on a shoulder, but you want to use it for a knee. Its intended use is not the same, so you couldn't use it as a predicate device. A reference device would say, okay, this coding was used in the body for long-term application. It was used on a different joint, so you can use that as a reference device. It's not super common to use a reference device, but it's a good thing to know that you can if you need to. From that search above of the predicate device, we want to propose a primary predicate device. It's best if you have a single device that you go through the whole, let's assume it's a 510K, one device that you are going to compare to. It has the same intended use, it has similar indications, technology is fairly much the same, not exactly, and you would propose a primary. FDA prefers that you don't use multiple predicates. You can, but you still are supposed to pick a primary. Something that has happened recently, there's a guidance that came out, other functions. So FDA understands that software might have, let's say it has primarily one regulated function where the functionality is, let's say it's the image viewer functionality is the regulated portion of it. And it has other functions along with it, like billing and utilization, usage, other things that wouldn't in and of themselves be considered medical devices. FDA has this a way now that in an application you say, okay, this is the regulated product or regulated function, and these are the other things. And what you do basically is you describe to FDA what the function under review is and then what the other functions. And FDA cares about the safety and effectiveness of those interactions from the other functions to the medical function. They want to make sure that the other functions don't adversely affect the primary medical function. So there's a series of questions that you'll answer. At this point in the plan, you pretty much know what your route is. You've understood the device. You've looked at the regulatory databases, and you've picked a predicate device potentially. You know it's potentially maybe a de novo. So you would document the route, the actions to be taken. Of course, the deliverables are the plan itself, and then the Notion templates have product documents, many product documents that are part of the, it'll be the design history file, but it also will feed the submission. Also your timeline, dates for milestones that you would need for your, to execute the plan. We also like to document any risks or challenges. Things come up. Let's say, for instance, I'm a big fan of doing pre-submission meetings. Let's say that the client doesn't have time for a pre-submission meeting. That would be a risk. Let's say there's some difference that you're not 100% sure that FDA is going to allow to be compared to a predicate that, let's say, does it differently or doesn't do that particular function. So we would list that. Just other things that we feel should be known. Can we mitigate them? And what the mitigation would be, what the risk level is. And for on the regulatory side, there's many guidance documents, and we've listed quite a few of them here that could potentially apply to that strategy for that particular product, as well as standards. 62304, IEC 62304 is a software lifecycle. That's pretty much standard. If you use that's state of the art. As far as FDA is concerned, it's a recognized standard. 14971 from a risk perspective. Medical device security, cybersecurity is becoming a big deal. That's getting only larger. IEC 62366-1 for usability, and then labeling falls under 15223-1. And that's pretty much it. So that's how we start out a project from a regulatory perspective. Thank you.